Sickle cell disease has high prevalence in Kenya and Western Nyanza County because of inadequate health policies and plans and scarce facilities, diagnostic tools, treatment services and trained personnel, beliefs and socio-cultural practices. Therefore, urgent interventions are needed to address this public health problem. We, the people living with sickle cell disease in Western regions, specifically in Kisumu County, are aware that the government of Kenya has put in place some interventions to address this challenge, like the national guidelines for control and management of SCD launched in 2021. We would like to thank the government for that, but we could also want the following demands to be heard and put in place and looked into. To be set up in all government health facilities in high prevalence regions, especially Nyanza, Western and Coastal regions. We are not just talking about Kisumu as a county, we are talking about the whole of Kenya, because this is not a genetic disorder that is only neutralized in Kisumu County and Nyanza region. Consider sickle cell disease as a national health problem and provide free medicines for management of the disease. The medicines required are like hydroxyurea, folic acid, Penv and Paludrin, of which hydroxyurea and Paludrin are not in stock in the government facility hospitals together with the chemists and pharmacies. So we'd like the government to look into that and help with the supply of the medicines mentioned. We will also like the government to provide oxygen cylinders in all health facilities with sickle cell support clinics set up. This is due to oxygen is like our first line of sickle cell management. Why? Because due to the sickle cell genes and blood disorder, we are not able to supply the whole body with sufficient oxygen. Meaning, in any case we find or have a crisis, the first thing that we are supposed to be done for is put on oxygen, depending on our oxygen levels. And some of the facilities do not have oxygen cylinders and enough oxygen. So we'd like the government to look into that and try provide enough oxygen cylinders and oxygen to their facilities. Conduct pieces of, we would also like the government to conduct pieces of training for a section of health workers to specialize in the management of sickle cell disease. This will help enhance response time, meaning if the government can add more health workers, it will help in terms of availability of ambulances that can help us get access from our homes to the hospital in a faster way and a way in which the sickle cell can start management from when the crisis hits.
The drugs of sickle cell disease patients in Kisumu is very expensive. One tablet goes up to 40 bob, and of late, for the past 3 months, the sicklers have not been able to access these drugs, especially in the public hospitals, because they're not there. So we demand for the government to make these drugs available for sicklers, just like drugs are available for people living with HIV and are available for people living with cancer. We have consistently approached the county government on this issue, especially the First Lady in Kisumu. She knows very well about issues around sickle cell, and even during the launch of the hemophilia, she was around and we talked about this issue. So why is it taking so long for something to be done about it? While we see on the other side, cancer is on the limelight. Why does the government is not taking time on our issues of sickle cell? I will say they have tried to subsidize, but if they subsidize, the drug is 40 bob, and if they subsidize, the drug is 30 bob. You know, this is still not affordable for a woman coming from Mudunga, because she has to feed her children, she has to take them to school, and also have to part with like 3,000 every month to process this drug. It still doesn't help people living with sickle cell. What will help people living with sickle cell is the provision of free drugs, free hydroxyurea, free folic acid, free Penv, to help them, because sometimes they only lack drugs. Sometimes a child is sick, but only the drug can help them. So why not give free drugs for these people?